professor in the School of Kinesiology at the University of Minnesota. Our systematic review paper, entitled Integration of Short Bouts of Physical Activity into Organizational Routine, identified 40 relevant peer-reviewed journal articles and abstracts published between 1960 and July 2010 on interventions that utilize short, structured physical activity breaks, which we defined as episodes of activity lasting 20 minutes or less. These interventions took place in organizations such as schools, workplaces, and faith-based settings. We all know that regular physical activity is important for good health, and there is growing recognition that interrupting prolonged periods of sitting and other sedentary behaviors may be necessary to promote well-being and prevent chronic disease. Recommended daily physical activity that may be accumulated in short intervals of 10 or more minutes may be more feasible and appealing than longer bouts, especially for sedentary populations. New and innovative ways to increase physical activity across a wide range of settings, sectors, and population segments must be identified. Organizational contexts such as workplace, school settings, and faith-based settings offer unique opportunities to expose people to physical activity promotion efforts. One such institutional policy is integrating short activity bouts into organizational routine. This policy has been implemented across a number of settings, including work sites, schools, and religious institutions. The short activity bouts, typically 10 minutes or less, have taken the form of brief aerobic routines held during meetings or events or at certain times during the workday, restrictions on nearby parking and elevator use, or walking meetings.
Hi, I'm Dr. Tony Yancey. I'm co-director of the Center for Health Equity here at UCLA and also a professor in health services. And I've had the opportunity over the last 10 years to work on a strategy for getting people up and moving. We came up with something called the lift-off. We created 10-minute lift-offs, and now we call them instant recess breaks because that communicates it a little bit better. Physical activity is probably one of the most potent tools in our prevention arsenal. Just short bouts of physical activity can lead to an entire range of health benefits, from lifting mood and helping to prevent or control depression, to improving productivity, partly through changes to our cognitive processing. We're actually able to process more efficiently when we're active as a whole, but also after short bouts of physical activity. Physical activity obviously helps to prevent cardiovascular disease and diabetes. It helps to control our weight. Really, there's almost nothing that it doesn't improve. The city pays for a lot of healthcare costs, not only for the residents, but for their own employees. And if, in fact, the city employees could even increase their physical activity levels by, say, 5 or 10 minutes a day, given that the average person is only getting 6 to 10 minutes a day, you're talking about being able to double or triple the amount people are getting. The opportunity is mandatory. I mean, we really are pushing for everybody to have access to at least one 10-minute exercise break a day. Ideally, we would like to see an instant recess break at least once a day in every office setting, and then whenever people are gathered for a meeting for an hour or more.
I think it's great, and actually it has energized me for the afternoon. I have done instant recess one other time at a meeting we had. Militia came and did instant recess at our Be Healthy Coalition meeting, and people thought it was great then, and I think it was great this time as well.
And it would be wonderful for me and all of my staff to have that kind of stress relief type of break and put some movement into it. It's really something I think we can incorporate, even at a staff meeting, to take a break as an icebreaker maybe, and do a little physical exercise. It helps you to kind of refocus and get back to your tasks that you need to do.
Individually focused education and counseling has failed to stem the tide of chronic disease and sedentariness. Interventions that aim to reintegrate physical activity into organizational routine during everyday life are promising avenues of practice and policy change and research investigation. Additional studies utilizing more rigorous methodology are needed to more definitively quantify the effects of brief bouts of physical activity on relevant outcomes. It's particularly important that studies collect and report process data about how the intervention was developed and implemented, and by and for whom. This information is necessary in assessing not only intervention effectiveness, but also feasibility and sustainability of approaches across time and diverse settings. We must act on the best available evidence and rigorously evaluate the results.